Today's episode is for any woman facing surgery, struggling with mystery midlife symptoms, or just wanting the real truth about menopause. I'm talking with Julie Pirana, who went through menopause a decade early at 42 after a hysterectomy she was told wouldn't affect her hormones. We cover how she connected the dots on her mysterious symptoms, the surprising gaps in medical training around menopause, and why her experience inspired her to become the Menopause Occupational Therapist and help women and employers navigate this stage of life with confidence. You're going to love her. Hello, my friend, and welcome to the Belong Wellness Podcast. I am your host, Jessica Long. I am a health coach specializing in perimenopause, a longtime fitness instructor, mama of two littles, and a wife. If you are a midlife woman wondering what the actual F is going on with your hormones, your emotions, your relationships, your career, and your life in general, then you belong here. Join me each week as I share my own personal stories of how I navigate this wild stage of life. I also bring in experts and fellow badass midlifers to share their incredible stories of career pivots, managing relationships, parenting, living a healthy lifestyle, and much more. So listen, if midlife has you feeling like you're just not yourself anymore and alone in the chaos, this podcast is for you. Grab your giant water bottle, snap on your weighted vest, and let's get to it. Hello, you get to hear such an empowering personal story from an uber passionate menopause coach today. But before we launch our interview, I want to do a quick listener shout out. This one is for my girl, Melissa G in Nashville. Melissa, you have been my number one cheerleader since day one. I truly can't thank you enough for listening to every episode, sharing the episodes with friends and on your socials, and liking and commenting on all of my posts and stories. Melissa also left the kindest review on Apple Podcasts. She said, "Loving every drop. Thank you, Jessica, for being a conduit for this energy and creating space for meaningful conversations that we need to have. Each topic resonates so much as if you knew what questions were going around in my head." Melissa, thank you so much. Your support truly means the world and helps other midlife women find this podcast. And now I would love to give you a shout out too. So head over to Apple Podcasts, click the 5 stars, and leave me a positive review. If you're watching on YouTube, subscribe to my channel. I'm new here. Give me a thumbs up, leave a comment. Let me know what topics are resonating with you. Thank you. Thank you. You guys are truly the best. Before we jump into today's episode, just a quick reminder that I am not a licensed medical care provider and do not provide medical services or advice. The information shared in this podcast is meant to be educational, not prescriptive. Please consult your medical doctor before making any changes to your diet or lifestyle. Also, the opinions of guests on the show do not necessarily reflect the opinions of Jessica or anyone affiliated with Belong Wellness. Today, I am excited to be talking to Julie Pirana, aka the Menopause Occupational Therapist. Julie, thanks so much for coming on the show today.
Thank you so much for having me.
Well, I want to start with your job as an occupational therapist. I know this has been your career for many years. Can you tell us a little bit about some of the clients that you've been working with over the years?
Sure. So I work in an adult inpatient rehab hospital. So I am treating patients who have been in the hospital for a number of weeks before they come to rehab. Many of them have had amputations, strokes, spinal cord injuries, various other illnesses. And they stay overnight in our hospital until they regain the skills that they need to go home safely and independently. So we're helping them get back to whatever their usual roles and routines were. We're trying to help restore their function. In cases where restoring their function isn't possible, then we help them learn how to adapt their environment or adapt the task to try to be as independent and as self-sufficient as possible.
Wow, that's so noble.
It is a very rewarding job.
Yeah, and just like teaching people the basics, right? I mean, some people have to relearn from the very beginning how to brush their teeth and get out of a chair and all the things. So, wow, that's incredible work that you've been doing. And you are now known as the Menopause Occupational Therapist. So I do want to talk about how you evolved. And in our conversation previously, you mentioned that this has to do with your own personal experience of going through the menopause transition before you expected. So I'd love to have you tell us your story and why this has motivated you to shift your focus, become a menopause coach, and help other women through the transition.
Sure. So as you mentioned, I did go through the menopause transition a bit earlier than expected. At 42, I had a hysterectomy. I had a condition called adenomyosis, which is sort of like endometriosis's evil stepsister. It's where the uterine tissue or the lining of your uterus grows into the muscle wall where it's not supposed to be. And that was causing a number of very unpleasant symptoms. I had a lot of pain. I had bloating. I had a ton of bleeding. Sometimes I was bleeding up to 35 days consecutively, and very heavy bleeding at times. So it was really just kind of destroying the quality of my life. It was very difficult just even to perform my job. So I had a hysterectomy. And my ovaries were left intact. So I had asked, will this impact my hormones at all? Will it affect the menopause transition? And I was told, absolutely not. You will go through menopause at the normal time because your ovaries are left intact, which made sense to me. So I did very quickly, easily recover from the surgery. I had immediate relief. I wasn't in so much pain. Of course, I wasn't bleeding all the time. But then pretty soon after surgery, I started to not really feel like myself. I started experiencing a lot of symptoms, but I did not recognize those symptoms as being part of the menopause transition at first because I didn't know what happened in menopause. I thought women had some hot flashes and night sweats and that was it, and you stopped having your period. I really had no idea that it impacts our bodies in so many different ways. And so at first, I didn't know the symptoms were menopause and I was not really sure what was wrong with me. But after, dealing with really bad brain fog and memory lapses, word finding problems, difficulty sleeping. I was getting new allergies, allergic reactions were happening all of the time. I had to take several rounds of steroids for horrible allergic reactions that I was having. I had plantar fasciitis, a bout of plantar fasciitis that just would not go away. And I'm a therapist, so I know all the things that I was supposed to do to treat that, and none of them were working. And so for many months, I had no idea what was going on. I was kind of going from doctor to doctor to try to figure things out. But then I started having hot flashes. And then I had this moment where I was like, oh, maybe this is a hormonal thing. And so I had some blood work done and I had like almost no estrogen. My estrogen was less than 15. My FSH was very, very high. And so my doctor sent me a message in my patient portal and it just said, you're postmenopausal, that explains your symptoms. And I was not totally surprised, but frankly a little pissed because I was told that wouldn't happen. And not only that, that's all the message said. There was no education, like, okay, what are we going to do now? No explanation. I went through the transition a decade early. Then, I was 42. The average age of menopause is 52. And so once I started to learn all about menopause so I could figure out what I needed to do to help myself, and after learning that early menopause put me at such a high risk for osteoporosis, for cardiovascular disease, for dementia, all of these things. My doctor didn't tell me any of that. And I learned that replacing my hormones was absolutely essential because I went through the transition a decade early. And if I didn't replace my hormones, like I said, I was at high risk for all these other things. And that was never offered to me. So, I just thought to myself, if I know so little about menopause and I'm a healthcare professional and I didn't know any of these risks until I did all my own research, the average woman isn't going to know any of this either. And her doctor's probably not educating her either. And I learned that doctors get no training in menopause. So, I didn't get any, and doctors don't either. Even OBGYNs, only 20% of OBGYNs get any menopause training at all. And what they do learn, many of them, is outdated old information from decades old studies, and they haven't kept up to date. And so that is really what inspired me, is at first to help myself, but then I got, just angry that how this system is designed not to support women in this stage of life. And so I decided to get a certification in women's health. And then I took 2 separate menopause coaching certifications so that I could really learn as much as I could about it and have evidence-based knowledge and tools to really help women feel better in the transition. I started hormone therapy, I started making lifestyle changes myself, and I felt so much better. And I just wanted to help other women do the same thing.
Thank you.
Yes.
We need the help. As a healthcare professional, when you went and did the initial research on yourself, did you have access to other, research databases that the average person does not? Where were you getting your information initially?
Yes. So initially, truthfully, I was getting a lot of my information on social media from experts like Dr. Mary Keller Haver and Dr. Kelly Casperson, Dr. Heather Hirsch. And then I read their books. And then, yes, I started to look articles up on like PubMed and really like read the research myself. A lot of those books that those physicians have written reference studies. And so, I'm kind of a data nerd. So I would look up the studies that they were referencing. And I especially did that with the hormone therapy because, like many women, I believed a lot of the misinformation that is out there about hormone therapy, specifically related to breast cancer. And my mother is a breast cancer survivor. She had stage 3 breast cancer. So I initially thought that I wouldn't be a candidate for hormone therapy because I, still believed that information that I think many of us were told a long time ago that we now know is not correct. But at the time, I didn't know any of that. So once I did my research on it, learned that, it is a very safe and effective treatment and that most women are candidates and that family history is absolutely not a contraindication to starting hormone therapy, I started it.
And to your point before, too, it's not just about alleviating symptoms in the present, it's about longevity and improving the quality of our life for the remainder of our years. So I think that sometimes gets lost in the conversation, too. We talk about it just kind of in the present tense, but really it's about quality of life going forward as well. Um, I do want to talk about your specific situation, though, because as I've always heard, too, if you're having a hysterectomy and only your uterus is being removed, that will not put you in immediate menopause. And that was not the case for you. Have you since learned why this happened to you and why we usually hear that if your ovaries are left intact, that you will go through menopause at the quote unquote normal time you would have, whether you have a uterus or not?
Yes. So for most women who've had a hysterectomy and their ovaries are intact, they actually will go through the menopause transition a little earlier. I think it's about a 2 to 5 year scenario where you'll likely go through menopause a bit earlier. And that's because blood flow to the ovaries can be impacted by the surgery. I don't know if I'll ever know in my particular case why it happened right away. I think probably what makes sense is that I did have my fallopian tubes removed years prior, like 7 or 8 years before my hysterectomy. So it is likely that with those two surgeries, my ovaries lost blood flow. It's also possible maybe I was already on the trajectory towards having an earlier menopause, and this was just kind of like the final nail in the coffin. I don't know if I'll ever have an answer for that, but since sharing my story, I don't know a percentage, but I have met other women who did have pretty much the same thing happened to them, that immediately after their surgery, they did start to experience some symptoms. And like me, it took them a while to figure it out because they did still have their ovaries. So they assumed that all these symptoms were related to something else at first. So it's probably unlikely that it's going to happen right away like it did to me. But I think it is good for women to know that it could happen and you likely will go through menopause a bit earlier. So if you have a hysterectomy in your 40s, just be prepared that the menopause transition may happen, 2 to 5 years earlier for you. And be prepared by knowing the symptoms.
Well, that's what I was just going to say. If you know the symptoms, then you know what to look for.
Right.
But to your point, up until very recently, no one was talking about the myriad of symptoms other than hot flashes. Another question I wanted to ask was, you mentioned brain fog, word recall, sleep disturbances. Looking back, now that you know those are menopause symptoms, were you experiencing any of those before your hysterectomy, or did those all just come on after?
They all came on off after. Definitely, I didn't have any of those symptoms, but I think I might have started having some of the musculoskeletal symptoms where I was like, I had kind of like an achy knee. I'm also hypermobile. I'm on like the Ehlers-Danlos spectrum. So I have since also learned that menopause can affect people with hypermobility a little bit differently too. So I think I was probably in perimenopause and I was having some of those musculoskeletal symptoms. That's why I had that bout of plantar fasciitis that would not go away. By the way, it went away as soon as I started menopause hormone therapy. So
Really?
yes, almost immediately. And it has not come
Wow.
back. So I think there were signs that I was in peri, but again, I did not know those symptoms.
Yeah, exactly. Well, none of us did.
Why didn't no one
Now,
teach us any of this?
thankfully, we're having these conversations and hopefully spreading more and more of evidence-based information. So, if someone listening is currently considering having surgery for their own personal reasons, whatever they may be, do you have any advice for questions that she should ask in advance of the surgery that you think are topics that may not come up if she doesn't bring them up?
Yes. So I do want to say, I don't want to scare anyone away from having a necessary surgical procedure. I 100% believe that my hysterectomy was worth early menopause. I feel so much better. And, granted, I had a few months where I didn't feel well and I had to figure everything out and start hormone therapy. And then it took a little while to get that optimized, but it was 100% worth the trade-off. My quality of life is so much better. So I don't want women to, delay necessary medical treatment if you're really suffering. I think having a hysterectomy really helped me tremendously. But just be prepared as we spoke earlier, make sure you kind of know what the symptoms are. And I would talk to your surgeon or your OBGYN and just ask, if this does lead to earlier menopause, what are my treatment options? Get a feel for what their answer to that question is. Some doctors are still not up to date on the safety of menopause hormone therapy. And if you are going to experience early menopause, it's probably a good idea to find another physician who can help you if you need menopause hormone therapy. So if your surgeon or your current OBGYN is not up to date, maybe find someone that you know you'll be able to go to should you need that treatment. Because my doctor didn't offer it to me. And by the way, I thought my surgeon was excellent. She was really, really good. I just think she didn't know any of this either. I don't think she was withholding this information from me because she's a bad doctor. She just wasn't trained. She didn't know this either. So if you know this going into surgery, I think it just can help you select your care team maybe a little more appropriately, or have someone ready to go to if you need it. And then also, hormone therapy is really only one piece of the puzzle. Implementing lifestyle changes is really essential for all midlife women as you're going through the transition. And if you are going to have a hysterectomy, you may want to set yourself up with some of those lifestyle changes now, so that if it does come sooner rather than later, you'll be that much more prepared for it.
Which lifestyle changes do you think have moved the needle the most for you?
So I was already very good as far as strength training. I have been a heavy weightlifter for decades now. So
Good
as
for
far,
you.
yes, I love lifting heavy weights. So I have been an avid weightlifter, and my nutrition was already really on point because of my strength training background. I had already been prioritizing protein and eating pretty healthy. The things I was not doing very well, prioritizing my sleep. Nervous system regulation was something that I just honestly thought was kind of woo-woo and silly. It never occurred to me how important those types of practices are until I went through this transition and realized how much our body really needs that. And so
Especially when the chemical messengers are doing things that the body has never seen before. I've talked about this before, but that's when your brain determines that your body is unsafe. And what does it do when it thinks your body's unsafe? It turns on fight or flight. Even if we have been poo-pooing it up until now, to your point, your body almost demands it at this point.
it
Do you
does.
have some favorite ways to regulate your nervous system?
Yes, I take my dog out for her walk. Like as soon as my alarm goes off, we're outside, and then that way I'm getting sunlight in my eyes. I live in the city, but there's a little grassy pathway on the way back to my apartment. So if it's nice out, I literally take my shoes off and walk on the ground and look in the sun for a few minutes and do some stretching and some breathing. I really love breath work. I really love listening to a meditation app. And even if it's just 10 minutes, either at the start of my day or the end of my day, It really does make a huge difference. And I wear an Aura ring, so I can see the data from this. And, if I'm not diligent with it, if I'm getting busy and I'm, not prioritizing these things, my sleep and nervous system regulation, I can see that like my readiness score tanks and my stress levels throughout the day end up being higher. So it really does make a very big difference. And this is one of the things that I work on first with my clients in my coaching practice is mindset, stress management, nervous system regulation. We really work on those things first before I address, working out and tackling nutrition. We really focus on these basics first. And like you said, getting out of fight or flight, or to the extent that we can. Many of us, there's only so much you can do. We can't take away every stressor in your life, but we can manage how we react to them, and we can prioritize taking care of ourselves a little bit more. I think this is the stage of life where your body is going to tell you that you absolutely have to do these things, or you're going to really burn out.
Yeah, I mean, we actually lose some of the hormones that have been helping us manage stressful situations up until this point. So it stands to reason that we need to find another path through stressful situations through this stage of life, because we literally don't have the same hormones helping us that we've had and been relying on for decades.
You replace them. I'm on hormone therapy, but I'm not replacing my hormones to premenopausal levels. So I feel significantly better, and most of my menopausal symptoms are managed between the lifestyle changes I've made and the hormone therapy. But to your point, the hormone therapy is not like a band-aid on everything, that even if you replace them, you're not back to where you were in your 20s and 30s.
Right. That's not the goal. We're not trying to restart our cycles and still be fertile. Like, no, actually, that's the good part. We don't want that anymore, or at least some of us don't.
Yeah.
What we want is just the right amount, as we talked about before, to manage, alleviate your symptoms and give you the longevity benefits. So we're not bringing them back to the levels that they were before. And our body has to create this new homeostasis, and we have to learn how to live with this new environment of hormones. We're not going to have the same environment that we had before. I know you mentioned before when we talked that some of the symptoms that you were having were affecting your work. Can you tell us which symptoms these were and how they were affecting you?
Yeah, so with the brain fog, that was really my most difficult, troublesome symptom. And I know it is for many women. It's often the first symptom. And I was making a few mistakes at work. In my inpatient rehab job, I have to enter billing at the end of the day, and I was sometimes either forgetting to bill or putting the wrong code in. I was sometimes forgetting to follow up on emails. So, I would read my emails in the beginning of the day, and before menopause, I would remember to follow up on things that I didn't have time to do in the moment, but I was just forgetting. And then I would sometimes get an email back from someone being like, circling back, like, hey, and I was like, oh my gosh, like I had never done things like that before. I used to be very reliable in that way. And I also, once the hot flashes came, with certain patients, if they're on contact isolation, you have to wear a lot of protective equipment when you go into the room, like a long gown that's like essentially made out of plastic, and there's no ventilation at all. And then you've got the gloves on and sometimes the mask on. So I was like overheating and having hot flashes. So I would sometimes have to, excuse myself from the patient and
Oh my gosh,
go
yes.
get a breath of fresh air, throw an ice pack around my neck. So little things like that. It wasn't to the point where I was like, my job was in jeopardy. And truthfully, a lot of these little things are mistakes that plenty of my coworkers and everybody else makes. I think as women, we're just so used to multitasking and being so on top of things, juggling, having multiple balls in the air and being able to just, do all these things effortlessly, that when you start to notice that there's these little breakdowns, it kind of freaks you out at first, because you're like, what is happening? And then you start to like doubt yourself and question yourself. So those were the types of things that were happening.
It's a deviation from your standard, right?
Correct.
Not to compare yourself to anyone else, but just it felt out of line for you. It didn't feel like you. And that's what people talk about when they say, I just don't feel like myself. This is a perfect example of that. So, you had the courage to discuss this with your boss, which sounds really scary. I mean, I think you mentioned you had a boss that you expected would receive this well and help you. How did that conversation go and how did you approach it?
So I had the conversation after I got the message in my portal that was like, you're postmenopausal. Because then I was like, oh, okay, this is what's happening. And so I did meet with her. I've worked there for 15 years. We have a very close relationship. So I think it's probably a little bit of a different situation for me that I did feel very comfortable talking to her about it. And mostly I just wanted to let her know, like, hey, this is what's going on with me. I figured it out and I'm doing something about it. And the funny thing is she had no idea what I was talking about. She didn't recognize any of these little blips that I was making that I was beating myself up about. She was like, what do you mean? Like, everyone does that. It's fine. So that was reassuring, but I also just kind of wanted to let her know, okay, I figured it out. I had already sort of implemented a few double checks and systems to sort of help me with things with the brain fog. Now I just would, at the end of every day, double check my billing, take 2 extra minutes to double check, make sure all my notes were signed, to make sure my billing was put in accurately. When I go in the morning, if I'm going through my email and I don't have time to reply to it immediately, now I flag them. And then at the end of the day, I go back and look at all the flagged things that I didn't get to. So, I developed some systems to help me. But I just let her know what was happening. I let her know that I had implemented some of these systems. And I requested that we keep the gym where we're usually treating during our patients during the day. I asked if we could lower the temperature in there by a couple of degrees because I was still struggling with hot flashes. And that was like the thing that was, really making it hard to do my job is when I was overheating so much. And so I just requested, can we turn that down a little bit? And she was happy to do that for me. And then I also got a fan at my workstation too, so that if I needed a minute to tuck myself away and just like shove the fan in my face for a second, I had that option.
That's so nice. I'm glad that you were very specific in your request and that she accommodated them and could. I mean, I'm sitting here thinking like, is there some sort of regulation about what temperature it needs to be in the room when you're treating the patients? But it sounds like you had some flexibility there and where she was able to meet you. Did that help?
Yes. Oh, it definitely helped. And also we have ice packs that we can provide our patients if they need ice packs. So sometimes I was just like, I'm going to have to grab one for myself. And I would just throw an ice pack around my neck and continue treating my patients. And I just decided early on that I was going to be vocal about what was happening because I'm actually one of the more senior, older people in my department. A lot of the clinicians that I work with are in their 20s and 30s. And I just wanted to sort of set the example that like we don't have to be embarrassed to talk about this. Every woman is going to go through this if she lives long enough. And, a lot of my coworkers openly talk about their pregnancy and everything that's going on with their deliveries and all of that. So why should I hide my menopausal symptoms and how they're impacting me at work? I just wanted to break some of these stigmas around it and just let people know that we don't have to be ashamed of it. We don't have to be embarrassed of it. Why don't we talk about it? And then hopefully that will help other people feel comfortable when it's their turn going through it.
Good for you. And you're doing your younger coworkers such a service by showing them and being a model and showing them like, hey, this is what's happening. By the way, this is what you can maybe expect. These are common symptoms. And I'm getting through it and I'm still going to work and I'm still having a great life. So it's nothing to be afraid of or swept under the rug or ashamed of like it has been for so many years. So that's like the perfect example of someone setting the new stage for how this is going to be for the next generation. Go, Julie.
Thank you. Yes. I really hope that our generation is the last generation that goes through this not knowing what to expect. I'm not sure why our mothers didn't prepare us. I can't blame my poor mother because she actually went through menopause as part of her cancer treatment. So she felt like such garbage that I don't think she really knew if it was menopause or cancer that was making her feel so terrible. So I can't blame my mother for not preparing me, but I just think it's wild that, we are getting to this stage and most of us have no idea what's going on and what to expect. So I think our generation being so vocal about it is hopefully going to help those younger than us, be a little bit more prepared and also know that they don't have to suffer. There are things that you can do to feel better.
Absolutely. And it's helping us too. I'm actually very thankful to be going through this transition right now, right when people are talking about it, talking about what our options are, putting more attention and research into what our options could be going forward. So I think this is a really fortunate time to be going through this. I mean, even just a few years ago, we would have had a totally different experience.
Definitely. Yeah.
So, yeah, thank you to all the women on the forefront of this movement. So, I did a little research coming into this conversation because I wanted to be able to share some numbers about the workplace. And according to a survey conducted by the Chartered Institute of Personnel and Development, 67% of women aged 40 to 60 with menopause symptoms reported that their menopause symptoms had a negative impact on their work. And a study by Fortune showed that 48% of respondents believe that women experiencing menopause are seen as less productive or emotionally stable in the workplace. So it's no wonder that women fear judgment or backlash if they do talk to their employer about this. Not to mention, like we were just talking about, the shame still exists, and it's just not something you necessarily want to talk to your boss about. So, given all of this and given your personal experience, what advice would you give to someone who is experiencing symptoms that are affecting her work? She wants help, she wants support, but there's trepidation having that conversation.
Yeah. So thankfully, the Menopause Society does have a lot of resources for this. So if you go to menopause.org, they have what's called their Making Menopause Work initiative. And you can print off resources for your employer that help you sort of have this conversation with them. It gives you tips on how to bring it up, but then it's also something that you can give your employer, and it gives them like actionable items and strategies and things that they can do to support women. I think it helps maybe your employer recognize that these accommodations that we're asking for are very, very simple things. They are very low cost, but they actually have a very large return on investment if your employer is willing to make some very simple accommodations for you, and basically foster a work environment where discussing this is okay and talked about. It really benefits them with retention and recruitment. And also, when you think about it, the women going through the menopause transition are the people who have all the institutional knowledge. They're the people that have been there the longest. They're very high performers. They're leading teams. They're important to the workforce, and it's in their best interest to keep them. And it's, not that difficult to give them a fan or, allow them to flex their schedule a little bit. Or, for some women, it's something like being able to work home remotely for a few days a week if that's possible. Very simple things can help make a huge difference. So I think if you're not sure where to start that conversation, that's a good place to start, is the Making Menopause Work initiative, just printing some of those and bringing them in with you. And I would say to make your request for an accommodation and make it in writing, because then you do have some protections in place. If they decide they're going to take any sort of disciplinary action against you or put you on some sort of a performance improvement plan, you do have protections in place if you have documentation that you did make a request that was not met.
That's good advice. And what advice do you have for companies about how you mentioned some of it in your answer just now, but do you have any more advice for companies for how they can accommodate women going through this transition?
Yeah, so I'm currently working with my organization to try to implement some menopause supportive policies in place because, like I said, these are very low cost initiatives, but if some simple things are just educating women about the menopause transition. And it sounds silly, like why should an employer have to tell women what happens in the menopause transition? But it's because no one told us this. And it's because women can suffer for years with these symptoms and not recognize that it's menopause. The statistics are a woman will see 5 to 7 specialists and suffer for over 5 years with menopausal symptoms before she realizes that her symptoms are related to menopause. So if an employer can help a woman have that kind of aha moment, like, oh, this is menopause, they're going to seek treatment faster. They're going to do something about it. And then their performance will improve. And then they'll miss fewer days of work. It costs companies, I think there was some statistic about over $1 billion of, productivity losses with, calling out sick or things like that. So if you just help women understand what happens in the menopause transition, do a little training with management so they know how to address these situations if an employee comes to them with questions or asks for accommodations, and then some of the simple things that we talked about, maybe having a different dress code. Some places you have to wear like long sleeves and all these layers, and maybe it's just as simple as allowing you to wear something else so that you're not bursting into flames and that you're a little more comfortable at your job, or having ice packs in the freezer, having a fan at your station, being able to take more frequent breaks if you need to use the restroom more often. Very simple things like that can really go a long way. And actually, Rhode Island just passed legislation that mandates this. They just became the first state to pass legislation that employers must provide menopause supportive policies and have menopause training as part of the workforce. I think it's if you have more than 4 employees, you are now required to do this. It's considered a protected status, just the way pregnancy is.
Progress.
Yes. Yeah. And there are a few other states that have legislation kind of like actively happening too. I think New York, Massachusetts, California, and there's even a national law that is being considered. So, and even existing anti-discrimination policies around age and gender and disability there are women who have won lawsuits using those anti-discrimination policies that already exist for those things. So you likely are protected, and not that we want to have to threaten suing our employers, but I think if they recognize that could happen if you don't just provide this very, very simple education and accommodations. It really, again, it's a low cost for a large return on investment to support your employees.
Yeah. And to your point about the education, you can recoup, right, what would have been lost wages, lost productivity by educating women and kind of getting ahead of the lost productivity, right, due to all of her menopause symptoms. So I love that example. Let's wrap up. What's one thing you wish everyone, not just women, understood about menopause?
I think it would be great if everyone just understood that it affects a lot more than our reproductive system, that it impacts our bodies in so many ways. If we take care of ourselves, if we prioritize our health, we don't have to suffer through it. There are absolutely things that you can do to feel better. So please don't suffer through menopause when there are things that you can do to feel better, and don't be afraid to speak up about it.
Thank you so much. Where can listeners find you to work with you? You offer one-on-one coaching. Do you come in and speak with employers and companies too? I think you mentioned you want to be doing that. Yeah. So where can everyone find you?
Yes, I am at themenopauseot.com is my website. And then I'm on TikTok and Instagram also, and YouTube, The Menopause OT, on all those platforms as well.
Awesome. Thanks so much for coming on and sharing some of your wisdom with us. I can feel the passion emanating out of you, and you're making change. So good for you. And thanks for sharing your story with us today.
Thank you so much for having me.
All right, friends, here are my big takeaways from this conversation. Number 1, early menopause after hysterectomy is possible even if your ovaries were not removed. I think it's important to note that this is not common. However, knowing what the symptoms of menopause are ahead of time can save you months or even years of wondering what's wrong if it does occur. Number 2, nervous system regulation is not just woo. It's an essential tool for managing symptoms, protecting your long-term health, and feeling more like yourself, which at the end of the day, that's what we all want. And I am cooking up something in this realm, so you'll be hearing more about this from me in the months ahead. Stay tuned. If this episode resonated, please share it with a friend. You never know who might be struggling in silence. And if you loved it, please follow or subscribe and leave a quick rating or review. It helps more smart and sassy midlife women just like you find us and feel seen. If you want to hang out with me between episodes, catch me on Instagram at Belong Wellness. Thanks so much for listening, and I'll see you next week.